السلام عليكم، بسم الله الرحمن الرحيم. هناخد النهاردة المحاضرة الثانية رقم 2 من موضوع الفيلر انجكشن. استعرضنا في المحاضرة الأولى حقن الفيلر في الأبر فيس اللي هو حالات فورهيد جبهة، الفراون لاين، جلابيلا، والتمبلز اللي هو الصدغ. وقلنا كبيجنرز مش هنحقن في الأماكن دي كتير، حتى كمان غير البيجنرز حالات اللي بتيجي في الأماكن دي مش كتير أصلا في العيادة. لذلك هنركز جهدنا على الميدل فيس واللور فيس اللي هو التلت اللي في النص والتلت التحتاني. وقبل كل دوت طبعا اتكلمنا ان بنقسم الوش 3 تلات: ابر، ميدل، لور. ابر بيبدا من الهير لاين لحد جفن العين العلوي. الميدل بيبدا من الجفن العين العلوي لحد السب نيزل اسفل الانف. واللور بيبدا من اسفل الانف لحد اخر نقطه في التشين اللي احنا بنسميها الابيكس اوف ذا تشين. دخلنا في الميد فيس وقلنا الميد فيس اللي يهمنا فيه كبيجنرز هم حاجتين: التشيكس والنوز، وممكن التير تراف لو هنعمل السناب تيست. قلنا التير تراف ديفورماتي، المشاكل اللي تحت العين. والمشاكل اللي تحت العين كتيرة، ممكن تكون مجرد لون غامق بنسميها الدارك هالوز او الدارك سيركلز اللي هي الهالات السوداء، مجرد تغير في اللون، وده ما بيتعالجش بالسوفت فيلر. وممكن تكون ده تجاعيد كرمشة جلد زايد اكزيس اوف سكين، وده برضه ما بيتعالجش بالفيلر. وممكن يكون حفرة او نقص في الكيس الدهني اللي تحت، فساب حفرة، ترك حفرة مكانه. ده اللي ممكن يتعالج بالفيلر بعد ما بنعمل حاجة اسمها سناب تيست. بندخل نحقن بإيه؟ بنحقن بكانولا زي ما انتم شايفين، ويكون قطر الكانولا 27 جي. كمان يكون نوع الفيلر سوفت فيلر خفيف، يكون من الفيلر الخفيف، كثافته خفيفة، ويكون قطر الكانولا 27 جي 27 جي. أخدنا بعد كده النيزوليبيال فولد اللي هي خطوط الابتسامة. وقلنا خطوط الابتسامة هي الخط الواصل ما بين الأنف والفم. ونراعي جدا ان احنا لو هنحقن المنطقة دي وبنحقنها بنيدل ان احنا نعمل اسبيريشن، يعني نشفط السرنجة لبره. هنشوف فيديوهات. بعد كده اخدنا التشيكس اللي هي الخدود، واخدنا كمان ما تحت الخدود السبزيجوماتيك سبيس. وقلنا التشيكس في طريقتين لحقن التشيكس: ممكن نحقنها بالكانيولا وممكن نحقنها بالنيدل. ممكن بالكانيولا وممكن بالنيدل. كمان لقينا في نوز كوركشن، ده برضو ما تشتغلهوش لانه دوت شوية متقدم. بس خليكم عارفين لو اللي فيكم هيشتغل النوز، احنا بنعالج بس التقدم بتاع عظمة الأنف أو النوز بون، عن طريق احنا ندخل بالكانولا من المكان اللي انتوا شايفينه ده. ندخل بالكانولا من المكان اللي انتوا شايفينه ده، ونبدأ نزود الفيلر بما لا يتعارض مع الخط بتاعنا او الستريت لاين بتاع النوز بتاعنا. طبعا هنا بنحقن بكانولا ليه؟ لان هنا مليانه شعيرات دمويه، من اهمها وشرايين، من اهمها السوبرفيشال فاتي لايرز، سوري، الدورزال الدورزال نيزل واللاترال نيزل. انا بتكلم في الطبقات، انا بتكلم في أوردة وشرايين. طيب ما نيجي نشوف فيديوهات، مهم جدا هنشوف فيديوهات على الكلام ده.
Using the rest of what I didn't use in her chin, just lightly in both of her cheeks. So she didn't have much of the
لو
surgery.
لاحظتوا هنا معلمة نقاط، النقاط دي متماشية أو متوافقة مع عظام التشيكس، وهوريكم أكتر في العمل.
Left, but I wanted to use it up because I don't really like to save filler. So we are using it in her cheeks, just doing a little bit of an enhancement. So just doing a little in the lateral aspect there, and then you can see I'm focusing the majority of it right into the apple or apex of the cheek. Right before I went in there, you can see I just kind of palpated for her infraorbital foramen just to make sure that I feel it, know where it is, and that I'm staying away from it. That's going to be the biggest no-go zone for cheeks. These injections are always deep down on bone. That's what we're trying to mimic with filler in this area, is that bone structure, giving really nice contour to the cheek, highlight. That's usually where natural light will hit the face to really bring out the highlight of the face. So the apple or apex should be the most full area, and that's kind of where I'm focusing it, as you can see. Always using a high G prime filler, and then always aspirating and low and slow pressure when I'm administering the product, typically never more than 0.1 in any injection, just to kind of ensure safety. All right, now that we've done that, what I'm going to do is do a little bit of mental shadowing. So we used a different filler in her lips, and again, this was just a little bit of an enhancement. She didn't want much in the lip at all. So she said, where else can we use it? And I told her she can use a little in the mental shadowing of the chin, or like that pre-jowl sulcus area, because she has such a really strong chin, and I wanted it to kind of just be more like seamless all the way back and just look really natural. So I'm adding just a little bit of a lighter filler in this area, just fanning it through with a cannula. Typically, I like to keep these injections like a little bit more superficial than I would the ones I was just doing deep down to bone. So you can see I'm using a cannula. It's just a way to get through the tissue a little more easily and safely
easily
and
and
just
safely.
give
سهل
product
وآمن.
in a larger surface area,
ونستخدم كمان في
rather than
larger
with the
surface
needle, you're
area.
very precise and staying in one area. So that's what I'm doing. I first gave her just a little bit of lidocaine to numb the pilot hole of where I went in with my needle. And this is a Comfortox cannula, and it's a 25 gauge by 50 millimeter length. And it's probably my favorite cannula that I use for filler. Typically, if I'm doing lifting threads or something like that, I use a little bit of
واحد
bigger
يقول لي يا دكتور
gauge, but
هو أنا ينفع
for
أستخدم
filler, I
الفيلر في
like to
كل
use a
أنحاء الوش؟
25 gauge. So you
أي
can see
حتة
I'm
شايفها
just
في
kind
الوش
of
إن هي
going in
محتاجة
and
تتعدل
lightly giving her
تقدر تحقن
a
الفيلر.
little bit, and I'm going to do that
بس
on
المهم
both sides just to
تختار
kind of
نوع
use
الفيلر
up the
إيه
syringe so
وتحقن
that
بكانولا ولا
she
بنيدل.
gets what she paid for and we aren't saving anything for her. This patient is awesome. She's been coming to me for a few years now, and she's always a great patient, and she understands facial balancing, and that, you know, if I gave her a little lip, she's going to need a little chin to balance that out, and the mental shadowing and the cheeks and full face treatment to really give her the best results. So we love patients like this. As you can see, this area can be a little bit more difficult to get in with your cannula because of the modiolus of the mouth. So like the corner of the mouth where everything kind of comes together, it's a little bit of a thicker tissue. So it can be more difficult to navigate with the cannula. So you can see our
عاوز أعرض لكم فيديو تاني. عاوز أجيب فيديوهات معينة تقدروا تستفادوا منها ويكون فيها الأشياء اللي أنا عاوز أوصلها لكم. الفيديو جاهز عرضه حالا. جاهز عرضه حالا. لا أكيد في صوت. في صوت دلوقتي صح؟ تمام. خلينا نشوف الفيديو ده.
Which is often a bit strong, but it's relatively smaller compared to the rest of the face. There's a slight upward tilt on the superior aspect of the zygoma. There's an anterior facing element. So if you inject here, you're going to project the cheek anteriorly. Whereas just a centimeter lateral, you're now projecting in this direction. If you're slightly higher, you get a slight wood upward projection. And I've started, particularly in females, trying to get onto this upper surface so that I get more of an upward projection. And we just need to, whenever you're thinking about how to inject, think about where the surface of the bone is. And if you feel along the bone, you can actually feel it quite easily, I think. You get a feeling for, over time, which direction that bone is facing. But obviously you can check before you inject as well. So you can feel the direction of her zygoma very easily, which is worth doing, and then you can feel the angle of it. There's definitely a shift in angle that's very easy to find. The main thing I want from an aesthetic perspective is to know where the angle of the cheek is and which direction I want to change it. Do I want to project outwards, in between, or frontally, anteriorly? And so that's the first thing I do, is just feel, and I get an idea with my fingers where the anterior and the lateral surfaces are, and then I feel for the corner in between those two, and that's running parallel with her lateral canthus. You can then use one of the other markings that's quite useful, is to draw a line from the root of the helix to the ala base. The only problem with this is you can draw a straight line in multiple ways because it's a curved surface, and you can miss that point. This is why I edged away from using drawings as much, as because I want injectors to feel the shape of it, because that's really what you want. If you want to create the beauty point, you're looking for that junction of actually three surfaces, so you can feel an upward tilt, a frontal tilt, inferior and lateral, superior and lateral, and I want it to be basically on that point that I can make out a string, or with me this direct attach. You get a certainty about what happens with this, create that rounder shape. Now remember, so quite often you need a little bit. Let's see what lateral the cheek junction. Here's the eyeball. There's the often in younger people as you do tear trough. Tear trough is quite common, even in kids. Whereas this makes you look tired or sad.
Yeah.
And it comes later on. It's only tiny. So that might be what I'd expect to work with later. So I'm not currently doing a lot anteriorly. If I was, and I might do this once I've done it, it would be, in terms of blood vessels, it's actually a relatively safe area as areas go. If you're going to be on the bone, there are not that many vessels to worry about. But we do have the transverse facial that, like a lot of blood vessels, likes to run where it is safer. So it's more underneath the bone. So it probably runs typically under the zygoma and then curls up a little bit at the front. Some small vessels there at the front. There's the zygomatic facial artery, which sometimes about a third of people have a little foramen with a tiny little artery that comes out of it. So they're a little foramen where your nerves enter there.
فيديو تعليمي مهم، بس أنا عاوز أعرض حاجة تانية. عاوز أعرض النازولابيال fold. هنعرض دلوقتي حقن خطوط الابتسامة، النازولابيال فولد. تعالوا نشوف النازولابيال فولد.
Laterally by the nasolabial fold, this area is our area of risk, and this is going to be where our angular artery, which is a branch of the facial artery, travels at a more superficial level. So when we're in this area, we need to be a little more cautious to avoid possible vascular occlusion. For our dermal fillers, this is going to be basically in the mid to deep dermis. So to make sure that we're in that level after we've cleansed the patient, we're going to measure the length of our needle, and where I see the end of the needle, that's where I'm going to make my entry site. 1, 2, 3, poke. I'm going to go in just at a depth that when I lift up the needle, I can see the outline of the needle, but I don't see any grayish discoloration whatsoever. If I see any gray...
قال إيه؟ قال عشان أتأكد إنها في الطبقة الصح عميق، يعني بدخل النيدل بتاعي وبعد كده برفع الإبرة لفوق. شايف النيدل بس مش شايف لون النيدل، حدوده الكاملة ولونه مش شايفه، وإلا لو كنت شايفه أبقى سطحي، لكن أنا شايف في حاجة مرفوعة معايا. هنا يلا أبدأ أحقن، بس قبل ما يحقن لازم يعمل aspiration.
That means I'm too superficial. But with this depth where I can see the outline of the needle and no color, that is a perfect depth. I'm going to aspirate,
aspirate أهو،
and this is just gentle aspiration,
بيرجع
just
البتاع
enough to
لورا.
kind of see if
gentle
there's
aspiration،
any
مش نقوم مسحبينها
blood in the tip of
جامد
my
جدا، لا بالراحة،
needle or the
سحبات
hub of my
خفيفة
needle for a
لطيفة.
good 6 seconds here. This is a pretty thin filler, so we'll see it relatively quickly if it was to be there. And then I'm going to apply pressure and inject slowly as I withdraw the needle. So this is called a
بيحقن
retrograde
وهو بيخرج
linear
النيدل
thread.
لبره.
And so I'm injecting
بنسمي الحقن
slowly
دوت حقن
as I withdraw.
خطي linear retrograde.
And then we will
حقن
stop
خطي
just
طولي،
prior to coming out of the skin.
يعني بيحقن وهو طالع لبره.
Now we can continue putting retrograde linear threads in this area until we get to the desired amount of correction, which is going to be all from our vision. So that first injection was about 0.05 milliliters of fluid. So aspirate again, aspirate before every injection. And this is again for a good 6 seconds, 8 seconds. The thicker the product, the longer you want to aspirate. And then we're going to inject slowly with even pressure as we withdraw our needle.
ده الحقن السليم
Now,
لخطوط
as we
الابتسامة.
correct this, we're going to continue going all the way down this nasolabial fold. So the next injection needs to end basically where my first injection started. So I'm going to measure where I see this mark on the needle. That's where I'll make my entry point.
بما ان الخط طويل مش هيجي
We
من أول
go
حقن،
in.
فباخد الحقن
I'm
على
going to
طرف
aspirate
مرتين
just like I
لثلاث
did in the
مرات.
first injection. And then inject as I withdraw. Now, if we want to put a second line of filler without sticking the patient again, we can do a fanning technique. So just before I withdraw the needle, I can redirect. And in this case, I'm going to go just medial. I will aspirate again. And now inject.
هنشوف في العملي.
Stop, finger off the plunger just before I exit. And I'll just continue working down the nasolabial fold until I have a visual correction.
لحد ما الاقي visual correction، يعني
aspirating with
مرئية.
each injection. Now you can see we are using Pronox. Pronox is a delivery system for nitrous oxide. Nitrous oxide is a means of analgesia, and it also helps some with anxiety and helps the patient relax. Our model today is having several procedures done for us to demonstrate on camera for your guys' education and for your learning. And so we are using Pronox in the office because for us to do the video and teach it takes a little longer, but this is not necessary for you guys.
قال لك مش اجباري يعني النيتريك دايكسايد، بس هو بقى طالع موضة في العيادات وخصوصا عيادات الاسنان كمان النيتريك دايكسايد. الفيديو ده مهم جدا.
Top of the ear through to the bottom of the nose, and then take a second line that runs from the lateral iris vertically downwards. Where those two lines cross is nearly always close to the central point of where the center of the cheek filler should be. And you can confirm this by just gently putting your thumb on the cheek and lifting. You can see that you want the filler tip, or that you want the tip of the needle that's injecting the filler to put the majority of the filler, about 3/4, right at that point, and then a little bit less laterally and a little bit less still further laterally. So in order to be able to fill those 3 areas from one injection point, the injection point needs to be in a position to fan such that the tip of the needle can reach those 3 points safely.
عاوز يملى الثلاث اماكن دول فهيدخل
The
بالكانولا
same position is marked on
يستهدف
the other
الثلاث كور
side,
دول
and I
الميديال
always get
تشيكس
my patients
واللاترال
to look
تشيكس.
in the mirror and agree with me that this is the position that they would like their cheeks to be enhanced. I think this is a very important step. What's surprising is the consistency of this point. Obviously, you don't normally draw in all these extra bits, but with a dry wipe marker, you can put them in when you first start using cheek filler, and then you can wipe them off simply with a damp cloth. Here, for the stage of the injection, I've wiped off the other marks. So checking where I want the tip of the filler to be, I tuck in, and this is a deep injection. Okay? So you slide in gently and then sit and wait, and do not inject at this point. If you see any evidence of bruise starting to form, then you may have hit a vessel. However, if there's no evidence of any bleeding, then slowly start to inject, and you'll see the cheek slowly
لو
start
ما
to
عنديش اي
lift.
دليل على الزرقان
This
والتورم
injection
يبقى انا مش
is
شريان ابدا
quite
احقن.
tender,
وطبعا الاسبيريشن
and it's important to let your patients know that they will feel the expansion pressure. In terms of hierarchy of pain, I think this injection is actually a little bit more painful than tear trough filler, and more painful than don't use any
ابدا
local
احقن
so roughly
لحد
half, and then the last millimeter of.
من هذه النقطة ابدا احقن الثلاث كور دول.
And I think for fairness I
Extra
haven't
specific.
edited that out. And you can see
Acqua di Joe, Giorgio Armani.
عاوزين نشوف فيديو تاني لحقن التشيكس. تعالى نشوف حقن التشيكس. من الحاجات اللي بتستخدمها كتير التشيكس والشفايف، اكتر حاجة مستخدمة، اكتر حاجة تشيكس والشفايف، مفيش اكتر من كده. وخطوط الابتسامة جمعوا التلاتة دول يدوكم 50-60% من شغلكم. خمسين 60% من شغلكم الحاجتين دول. فلذلك لازم تمارسوهم كويس جدا. طب انا شغل الفيديو. ركزوا معايا على الفيديو ده.
Anatomy, tiny little pinch. So we're going to go, and I'm always pushing up. So you notice that my hand, without distorting the anatomy, is pushing in the direction that I'm trying to achieve. So I'm always going for that lift. I'm at the bone. I stabilize my needle. I aspirate, and then I'm slowly going to put a small aliquot. I usually start with about 0.1. I come out and I reevaluate. Now she has beautiful tissues, so literally that 0.1 just kind of made that area just pop out very nice. All right, so we're gonna take a look, and now I'm gonna go on this side here. Tiny little pinch. Now she has been icing before. I like to ice before the procedure. That helps to vasoconstrict any vessels. We're going down to the bone. We're aspirating and we're injecting very slowly. Now she is a great patient because tiny bit of filler goes a long way with this young lady. All right, tiny little pinch. Down to the bone. Little pressure. Anything bleeds, you hold pressure. Pressure is your friend.
Hold the pressure.
It makes a tiny little bruise, and it keeps it tiny as opposed to you continuing to let it bleed. And then next thing you know, you have a giant hematoma. And depending on the skin color or pigment, you have somebody that has a permanent bruise for 6 months or more. So always keep that in mind. Pressure is your friend. All right, so have the patient look at you so you can reevaluate. Beautiful. One more little pinch here. All right.
طبعا ليا نظرتي انا كطبيب بشوف بعينيا هل الكميه متساويه، الاتنين زي بعض، اليمين زي الشمال. عادي جدا احيا منطقه وارجع ابقى.
All right, guys. So inject slowly, aspirate. Make sure you're at the level of the bone. These are the ways to keep yourself safe. Nothing is 100%. Look at me, but it definitely helps. Now she has beautiful anatomy to work with. So with her, we're not so much doing high quantities of filler, but rather smaller aliquots. Ask her to smile. Go ahead. Perfect, relax. Because all we're trying to achieve with her is just to give her a little bit more apple in those cheeks that already look great. You don't want to add large amounts of volume because you don't want to make her look overfilled.
هي مش محتاجه تكون overfilled، مليانه زياده عن اللزوم. overfilled.
Good, and relax. Perfect.
ليه
Almost
بتطلب منها
done.
تضحك؟ لان مع الضحكه بيترفع الخدود، فلازم اشوف دي كمان.
And I'm actually going to go a little bit lateral just to make her a bit more symmetrical.
عشان يبقى more symmetrical، يعني اليمين يبقى زي الشمال.
And we are done. All right, so I always tell my patients, there's nothing you need to do except tonight I want you sleeping at a 45-degree angle. And that's just so tomorrow there's not a lot of swelling associated with the filler. Try not to touch it, not to massage it. I want it where I put it. The filler doesn't really become permanently at the site that you put it in for about 2 weeks. So you don't want them sleeping on it if at all possible. So if you can sleep on your back tonight or for the next few days, that would be greatly appreciated. All right, you feel okay?
Great.
Awesome.
awesome. فمهم جدا ان احنا بنتكلم فيه دوت. هنطلع بريك 5 دقايق ونرجع نعاود البث بتاعنا مرة تانية. هنرجع نشغل فيديو مهم جدا عن حقن التشيكس، برضه مهم جدا حقن التشيكس.
Reset. Back here, that far posterior, that zygoma does get very, very narrow. So that's why it's sometimes a little bit difficult to find it. No big deal.
هنا حقن التشيكس خدود اهو. ايه الصعب اللي في كده؟ خدود وبنرسم خط كونتور على العظم بتاعت الزيجوماتيك بون والزيجوماتيك ارش، وبنحاول ندخل بالنيدل على مدار الخط اللي احنا هنرسمه.
You don't want to fish around too much, so I kind of reset and then I go back in and add wherever I see that deficiency still is. You can see here that I decided I needed a little bit more in the kind of right in the apple of that cheek. As we age, we definitely lose mid-face volume. In this patient, it's apparent in kind of where that apex should be. I want to build that lateral support.
انا لو شايف ان في حته لسه ما اتحقنتش زياده بقوم داخل واحقنها زياده. احنا لسه الكلام بنقول يا هادي.
Of course, but we also need to focus on building that, that apex in the apple of that cheek so that the eye is kind of drawn there rather than that lower face or, more laterally. You can see here I'm adding a little bit more posteriorly, and I'm really wrapping up the rest of this syringe. I've used a total of 1 cc on each side for this patient, and you'll see at the end we ended up with a really nice result. I'm just doing one more injection and then I'm finishing up that syringe. You'll see that I start to really smooth this product out. Of course, prior to each injection, I'm doing a proper aspiration and using that gauze. I'm cleaning off my marks now, and I clean those off anytime they become kind of more distracting than helpful. Of course, I always want to maintain safety. That is my #1 priority. Wiping all of that off. She's not bruised too badly. She does have a little hematoma posteriorly, and I'm kind of just massaging it slightly, not too much
لو حصل زرقان واحمرار وبروزنج ما فيش مشكله، دكتور عم هيروح مش هيطول.
pressure because it will be painful for the patient. I have some arnica gel back there on the cheek, and I'm going to use that with some gauze to really kind of manipulate that product. I'm using gentle pressure to just make sure that all of that product is kind of integrated into the tissue, no major lumps or bumps, and I'm evaluating from behind the patient so I can see really how that cheek is looking. Stay tuned to see this after. Here you can see that I am checking cap refill around that bruise just to be sure that her cap refill is within normal limits, and it is. So after all, it is just a small little bruise and we're not too concerned.
حتى نتأكد إن حصل المادة بتاعتي انتشرت كلها. تعالوا ننتقل لحتة تانية خاصة بالتشين انجكشن أو حقن الدقن. حقن الدقن. حقن الدقن أو التشين انجكشن.
Looking at their profile, we pay attention to
بنعمل
what
اختبار اللي انتوا شايفينه دوت اسمه ريكتس اي لاين. المفروض الاختبار دوت ينتج عنه ايه في الحالات المثالية؟ ان مقدمة الانف تلمس الابيكس اوف ذا تشين اللي هي قمة التشين، الاتنين يلمسوا بعض وما يلمسوش الشفايف. يبقى مقدمة الانف تلمس الابيكس اوف ذا تشين وبدون ما يلمسوا الشفايف. لكن في الحالة اللي انتوا شايفينها دي مقدمة الانف لمست الابكس اوف ذا تشين ولمست شفايف. ده معناها ايه؟ ان التشين محتاج يحصل له تقدم شويه، محتاج يحصل تقدم للتشين شويه. فلذلك الحاله ديت حاله نموذجيه ان احنا نحقن فيها فيلر. تعال نشوف هيتم ازاي.
We call the rickets line. So it's kind of that line from the tip of the nose to the chin, and your lip should sit behind this line. And as you can see, her lips are kind of touching right at where the marker is, so we know that that says she needs a little bit of chin, so that those lips are sitting behind that rickets line, okay? So for a female chin, we like to keep the width of it pretty medial, because we all know that a wider chin is a little bit more masculine. It squares off the jawline, and most females don't want that. So for a male, we usually go from oral commissure straight down to kind of give that nice squared off appearance. For a female, we're going to stay kind of at the width of the nasal ala, straight down, and I usually just draw kind of like my straight lines straight down from there, so I know I want to stay within this area when I'm injecting, so that she'll get a nice kind of heart-shaped appearance. What chin filler does is actually, you know, it balances out that lower face. It makes your profile look nice and balanced and proportional. And it can also kind of elongate your jawline, give a little bit more definition here, because we're actually kind of lifting this tissue. And it can kind of lift a little bit of the submental area as well. So we're gonna go ahead and get started. If you need a break at all, just let us know, don't worry. Allowing you that. So she was topically numbed for 10 minutes prior. We are using some Voluma on her. So these are a little pinch.
بناخد فولد زي ما انتم شايفين، بناخد فولد ونبدأ ندخل فيه النيدل ونبدأ نحقن زي ما هتشوفوا دلوقتي. ده حقن التشين.
Good. And you can see that we're doing deep injections, always aspirating, and then low and slow pressure. Perfect.
Chin injection.
And most of the time, a chin
لو شايف ان ما
can surprise you with how much filler that it can take sometimes. A lot of the times you can fit almost an entire syringe, if not a whole syringe or more, in someone's fillers or in someone's chin, especially if they really need it. So as I said, she was topically numb. That just kind of helps to take a little bit of the edge off from the needle. Doing okay?
Mm-hmm.
مفيش مشكلة خالص ان انا احقن اكتر من نقطة واوقف وابعد عن المريضة وابص من جميع الزوايا وارجع تاني
I always just push about 0.1 at a time, just to make sure I'm not giving too much at any given time. And I'm also monitoring the tissue as I go through the process. That's already looking really nice.
لحد ما احصل على كل شيء.
Once I get about halfway through the syringe, I'll probably have her sit up a little bit and really look at her from all different angles and make sure it's turning out how I want it to. But so far from this side, it's looking really good. Put your head down a smidge, like almost tuck your chin. Yeah, I just want to see from that angle. Okay, you can just be centered again.
هبدأ اسرع شوية لان كل اللي جاي هو عبارة عن ان انا اشوف اللي محتاج زيادة.
I always support above and below when I'm depositing the filler, because I want to make sure it's actually staying on the chin and not migrating down. So always supporting, putting a lot of pressure underneath so it doesn't migrate off that chin area.
نشرحها.
Okay, so I've used about half a syringe, so I'm gonna just kind of look all around. And then usually at about half a syringe, I like to switch my needle anyway, because it starts to dull, and to keep the patient as comfortable as possible, I like to put a nice sharp needle. So I'm just gonna kind of walk around her and see what we're looking like so far. You doing okay?
Yeah, it is numb.
Feel weird getting her numb as it goes, yeah. So the product itself also has lidocaine in it, which kind of contributes to that. So sit up, kind of like, just keep it tall for me.
Put your head down a
يمين
smidge.
وشمال
Good. Look center.
اهو.
Look the other
ناقص
side as well.
حته من هنا حته من هنا.
Nice.
ارجع ازيد تاني.
Okay.
في
Cool.
حالات
That's looking really
بحقنها
good. All right. You can relax back. I'm
بالبريتنج
just gonna switch my needle real quick.
احيانا.
We're gonna do a little bit more. So I'm looking at areas where I can still see some deficiency. So I always look profile. I look at her straight on. I have her kind of tilt her head down so I can kind of almost look like from behind and make sure it doesn't look like it's deficient, and I still can see some deficiency kind of right in the center. So I'm just gonna go there.
chain
I'll go one more
augmentation.
time. Might sting a little bit. Okay, you ready? Mm-hmm.
اهو كل ده chain augmentation.
I'm gonna come here.
حقن الشين من اسهل الحاجات. حقنه سهل لكن اللمسه الجماليه والنظره الفنيه هو ده يعني اللي محتاج تركيز منه. لكن اذا كان على الحقن فالحقن سهل ما فيهوش مشكله. احنا خلصنا البث النهارده.